Straight ahead on the program, our healthcare experts discuss the latest in medical news from the previous month, and then they answer your questions.
Support for What's Health Got to Do with It is provided in part by the American Brain Foundation invests in research across the spectrum of the brain, knowing all brain diseases, disorders, and injuries are connected. There can be no cures without research. Learn how you can make a difference today at americanbrainfoundation.org. Rethreaded knows human trafficking destroys lives, but they also know it's not the end of the story. Rethreaded believes in the potential and power of all survivors to reclaim their lives. Visit rethreaded.com to learn more. And Elevate Med. Through mentorship, leadership development, financial literacy, a robust peer network, and tuition-based scholarship support, Elevate Med is dedicated to the next generation of diverse physician leaders as a tangible step towards the eradication of health disparities. More at elevatemed.org.
Hi, I'm Dr. Joe Sirven, a practicing neurologist at Mayo Clinic and professor of healthcare administration and policy at Arizona State University. This is What's Health Got to Do with It, which looks at where and how healthcare intersects with your life, helping you get the medical answers you want. Coming up, it's our monthly medical roundtable, your front row seat to the health headlines you couldn't miss. We're diving into the stories making waves, a raw milk illness outbreak, a deadly Legionnaires cluster, new insights on preventing Alzheimer's, Ozzy Osbourne's latest chapter with Parkinson's, and a breakthrough IVF technique, and the troubling rise of cancer in young women. Then, our experts tackle your biggest questions and break down what these stories mean for you. But first, August brought a whirlwind of medical news. Let's unpack what's shaping the future of your health. Joining us to talk about these topics are our incredible list of experts. We have Dr. Amy Hessler. She's a practicing neurologist here in Jacksonville. Dr. Hessler, welcome as always.
Thanks for the invitation, Dr. Sirven. I'm excited to be here again today.
We always love having you here. We have Dr. Donna Ivory. She is not only an OBGYN, but she is a podcast host in her own right, an author, and we love having her here. Dr. Ivory, welcome back.
Dr. Sirven, thank you. Thank you. Always glad to be here.
It's great to have you too. And of course, Chad Nielsen, another stalwart of the show. He is our infectious diseases expert. He is Director of Infection Prevention and Control for Nemours, and he's based out of Orlando. Chad, welcome as well.
Thank you for the invite, Joe.
Chad, we're going to start with you because this was a big headline in August, and that is the Florida health officials warning of raw milk dangers after 21 infections, including children that were impacted. So we know that Florida health officials issued an alert about this raw milk outbreak. As I mentioned, 21 people, 6 kids across North and Central Florida. Now, the illnesses included serious infections like Campylobacter and E. coli, and there were 7 hospitalizations and 2 severe complications. In Florida, raw milk is only legal for pet consumption, but some drink it for perceived health benefits. Now, to further add fuel to this story, Florida Surgeon General Dr. Joseph Ladapo struck a different note than federal health agencies, and he posted on social media, and I will quote it here, "Floridians have the freedom to make informed health choices. I support the decision to consume raw milk when sought for potential health benefits and protective factors. Be aware of your source and know the risks," close quote. Now, that's a very sharp contrast to the CDC and FDA, which warn pasteurization is essential to protect against dangerous foodborne illnesses. So, Chad, why does raw milk pose such a high risk for dangerous infections compared to pasteurized milk?
Well, Joe, this has been a hot topic, and to be very clear, these organisms and the ones you mentioned that were linked to this outbreak frequently show up in raw milk. Cows can carry any number of infectious diseases and frequently not have any symptoms of it. So when they don't have symptoms and they are contaminated, it passes through to their milk. And then unfortunately, some people are drinking that milk without pasteurization. I want to talk about pasteurization though. So what pasteurization is the heating of milk to essentially kill microorganisms in it and make it safe for human consumption. So when you go to the grocery store, the majority of the milk you're seeing on the shelves has been pasteurized through in accordance with pasteurization rules and sort of Florida and federal laws. And that's what we should be drinking. When you skip that process of pasteurization and you purchase raw milk for human consumption, you are opening up yourself to any number of hazardous health consequences due to infectious diseases.
What misconceptions drive people to drink raw milk despite these pretty overt warnings?
Yeah, well, I think the Surgeon General here in Florida, made mention that people are seeking raw milk for perceived health benefits, and so what some of these things are being claimed is that raw milk can cure lactose intolerance, or that it can prevent allergies in your kids, sort of akin to what they say about honey in your local areas, or that it even prevents other types of illnesses, and because it contains probiotics. I want to be clear, though, that the social media influencers and the other people pushing these claims, it's just misinformation. None of those things are true. None of these perceived benefits have held up to scientific scrutiny. And so, we've got a lot of people out there pushing this idea of raw milk. And what I always say when it comes to anything on social media, right, is look who's selling what. Why is person X trying to sell you product Y, and what do they seek to gain from it? Because there's a lot of snake oil salesmen out there in social media that are pushing information to make a dollar, and they're not concerned with the health of their consumers.
Chad, what do you think in terms of this question? I mean, how can health officials better prevent outbreaks that are linked to products that are sold for pet use only? I mean, to me, that's pretty clear. So what is there any insight onto a different approach?
Well, you're right. There's this pet label use only sort of thing floating around in the raw milk community, and I think we're about to see that being challenged because one of the individuals who had an infected child has levied a lawsuit against the farm under the guise of, well, it said pet use only, but I didn't know it could make me this sick. And I think that's an important point that's being brought up in that case, is that pet use only doesn't mean a lot to people. And frankly, it's a loophole. It's a loophole that allows farms to sell raw milk to the public without really any consequence at this point. And so, if I was serious about stopping outbreaks in Florida due to raw milk, I would end that animal conception loophole. In no world would a veterinarian tell you to give raw milk to your pet cat or dog.
Yeah,
They suffer the same infections and consequences in many ways that we do when drinking raw milk. And so I think getting rid of raw milk in that pet consumption label, I think will go a long way to help this. And then I think we also, in the public health world, need to be very consistent in our messaging. It's not just don't drink raw milk. It should say, don't drink raw milk because you could be seriously infected, and that could lead to hospitalization.
Chad, I'm going to ask you just one more question, and this is more philosophically bent. When it comes to food freedom versus food safety, I mean, where do you draw this line, and who gets to decide? Because I think this is where we're at.
Yeah, that's an excellent question, and it highlights the ongoing debate, I think, in our field of public health, particularly concerning this Make America Healthy Again movement, right? The MAHA movement, as it's being called, that the Surgeon General here in Florida seems to hitch on to. But I want to take this very philosophically into the legal realm. In the United States, the government has the authority to establish public health regulations, and they actually have for the last 125 years. We have seatbelt laws to protect individuals. We prohibit cigarette sales to minors. We have, strict rules about, federal drug laws about possession, use, and sale. All of this is in regards to safeguarding the public's health. And so I think as new trends and frankly fads are emerging, I think it's crucial to maintain that transparent dialogue between scientists, physicians, public health authorities, the government, to ensure that our community is getting well informed and well researched and backed information so they can make the right health decision. I do support people having the right to decide, but they need to be getting good information in order to make a good decision.
We're going to pivot to yet another big headline, and this is very different. And this has to do with Ozzy Osbourne. And sadly, Ozzy Osbourne, very famous metal rock star, passed away, and Parkinson's disease was part of the reason. Dr. Hessler, we're going to turn to you on this one. The recent death of rock legend Ozzy Osbourne has brought renewed attention to Parkinson's disease, a progressive neurological disorder he battled for years. He was diagnosed with a rare form of Parkinson's called Parkinsonism, which was linked to a gene which can cause symptoms similar to classic Parkinson's, but with some differences. As a reminder, Parkinson's disease affects movement, can cause tremors, slowed movement, and balance problems. Experts stress that Parkinson's varies widely among individuals, and ongoing research continues to seek better understanding and therapies. So, Dr. Hessler, what maybe the easy way to put this, what was the form of Parkinson's disease that Ozzy Osbourne had?
Okay, Joe. So this is the number of times I've been on your podcast and you've invited me. This might be my favorite question of all time.
Okay.
And not because Ozzy is gone, that, he lived a very colorful life. I think everyone can, he was part of the Black Sabbath and then the Osbourne reality TV show. But the reason it is my favorite is I actually, as a neurology resident, cared for Ozzy Osbourne in my training.
You cared for him?
I did care for him. He was referred to one of my mentors in Boston at Tufts in 2003. And I did take care of Ozzy Osbourne. So I did get the pleasure of meeting him. As my mentor, Dr. Alan Roper, who's a giant in the field of neurology, said, is that Ozzy was quite a nice man, but he's known for lots of colorful things. Let's say that. But as far as to your question, what distinguishes Parkinsonism from Parkinson's disease? And it's actually interesting. I actually found an article back in 2003 after Ozzy passed away, and at that time, it was written in the media that he had tremors, but it actually said in this article that came out of Tufts that he actually wasn't diagnosed with Parkinson's. And so Ozzy himself actually said in 2020 is when he admitted that he had Parkinson's. Now, this Parkinsonism is I explain it to patients as an umbrella term. People can have Parkinson's features, and as you mentioned, Joe, it's the slowness. It's we call it bradykinesia. It's the slowness of movement. It's rigidity. It's also a resting tremor and postural instability. But Parkinsonism, being that umbrella term, can have lots of different types. It can be idiopathic Parkinson's disease, where the dopamine cells in the brain don't produce the dopamine. And I liken this to greasing the wheels. So therefore you have slowness of movement. So if it's Parkinson's disease and that chemical, that neurotransmitter isn't made, then people can have that slowness of movement. But people can also have strokes or environmental factors that can cause Parkinsonism. So if there's not a blood test, this is a very much what we call a clinical diagnosis, so how a patient presents. Now, Ozzy's he actually had a genetic mutation that has been discussed out in the media. So that oftentimes can present earlier in life. And so actually that article that was published in Tufts in 2003, he actually had He was only 54 when he developed his
Wow.
tremors. And actually, reading that article, he had tremulousness since his 20s. Now, the other famous person that comes to mind is Michael J. Fox,
Sure.
and he also has a genetic mutation as well. So the difference, though, to answer your question, is besides that bradykinesia, sometimes the medicine that we use to replace that neurochemical, that neurotransmitter that's missing, can lead to abnormal movements. So these folks, and one can think of Ozzy or Michael J. Fox, they can have dyskinesias, which is abnormal movements related to the medications that we're using to treat them.
Wow. I'm still trying to kind of process the fact that we got someone who's treated Ozzy Osbourne, but I love this. I love surprises on the show. Dr. Hessler, let me kind of, this is a big question, but I'm going to kind of ask you to kind of narrow it. What's the biggest research or advance offering hope to help other people who are struggling with Parkinson's?
So there is medical treatment. There's also surgical treatment for Parkinson's patients. But there is ongoing research. There's also so those motor symptoms, the tremor, the slowness, are what we call motor symptoms, but there's also a lot of other symptoms that people can have as well. But that research is really important because there are thought to be, Joe, 10 million people worldwide, 1 million in the US that have Parkinson's. So, the thing that's been available is really surgical intervention. And we hope that the funding continues for this important research that affects 1 million Americans a year, because there's a lot of, besides just the motor symptoms, there's a lot of these non-motor symptoms that we need to diagnose earlier, or in that what we call preclinical stage, before they've presented. You actually have to lose a lot of those cells before you actually present, to recognize those people that we can hopefully intervene and help with.
I love this. I'm going to pivot to a very different topic now. And Dr. Ivory, I'm going to point this at you. The New England Journal of Medicine had a big article on in vitro fertilization technique using DNA from 3 people that prevented an inherited disease. Now, scientists in the United Kingdom have successfully used a groundbreaking in vitro fertilization, or IVF short, technique called pronuclear transfer that involves DNA from 3 people, the mother, the father, and a female donor, to prevent a devastating inherited mitochondrial disease or diseases. The method was applied to 22 women at a fertility center, resulting in 8 healthy babies. And the technique works by transferring the nucleus of the mother's fertilized egg, which contains the parent's genetic material, like any other person, into a donor egg that's had its nucleus removed, but has the healthy mitochondria from the other mother. That's a lot that I've put in there. Maybe I'm going to ask you, Dr. Ivory, can you help us understand how does this technique prevent mitochondrial disease? How does the genetics work here for people who may be wondering and listening?
Well, Joe, it really is simpler than it seems. So I'm going to give you the analogy. Let's think of a chicken egg. Okay. So if the egg yolk is the nucleus, and the egg white is everything else that includes the mitochondria. So just imagine that you have a hen that you have a hen that lays an egg that's got green egg white. So instead of is egg green, the yolk is fine. There's no problem. But they have green egg white. And when she has a baby, that baby can't walk, that baby can't feed itself, that baby dies early. And so there's a problem. The problem is in the egg white. So if you think of the egg white as where the mitochondria are, the problem is there. So what they did, it was take the egg yolk from the one with the green egg white.
Right.
And they took that egg yolk and put it in a different egg that has normal egg white. That's the way to think about it. So when you think about the genetics, if you look at a paternity test and a maternity test and to see who the parents are, there's no question who the parents are, because the components of autosomal DNA are in the egg yolk, and they come from the original couple that the female has the problem in her mitochondria. What happens is when we start talking about tracing genetic linkage, genealogy through a maternal line, that is all going to go away now, because now the maternal component of mitochondrial DNA is coming from a third human, a second woman. And so that's going to have a lot of impact genealogically over time, but it shouldn't have any impact when we talk about the autosomal DNA and issues of parentage and inheritance of genes.
So Donna, this technique is banned in the United States. And so maybe the question I just put out, what are some of those, and I think you've alluded to this, but what's like the ethical and even scientific challenges that kind of come up when it comes to this 3-person IVF method?
Joe, I think, I think we don't even know all of the ethical dilemmas, to be honest.
Yeah.
When you are now that we're mixing those components, it's not the mitochondrial disease side, it's the technology to be able to do it. So what keeps us from doing anything like that for any other reason?
Yeah.
What if I could artificially create a genome and then just go take an egg and place that genome in an egg? I mean, really the barrier right now to full artificial reproduction is that you cannot duplicate what the female body does up until about 20 to 22 weeks of gestation. And so the people who will be ethical aren't doing these things. It's just the things that are getting done. There are people who are unethical that are going to do crazy things. So I think we don't know what is coming out of this Pandora's box, but it is certainly something worth paying attention to because of the advance in technique.
So on that line, this is a huge technique for people who we're going to take it for a good intent, this mitochondrial. I loved your analogy, the green egg white that have this history of bad mitochondrial diseases. So this are the implications. This is life altering for those people.
It's huge because mitochondrial diseases are devastating. They're not common, but there are populations in the world, especially populations where there is a small closed genetic group. So you see increase in rare diseases. Those types of populations have more mitochondrial disease, and it is devastating. And being able to take that off their plates, moving forward in their families, is huge. So no one's angry or upset or feeling worried that this is the wrong thing to do, because it's the right thing to do for these people. The technique, however, just opens up so many other avenues, and the question becomes, what will misuse look like, and what are the implications of that?
I'm going to just leave that with a stay tuned, and thank you for that great analogy. And to all of our listeners out there, you're listening to What's Health Got to Do With It on WJCT News 89.9. I'm Dr. Joe Sirven, and if you're just joining us, it's our monthly medical roundtable, and we want to hear from you. Tag me on social media at @JSirven. We're going to pivot to yet another topic, and this has to do with lifestyle changes, which includes walking and diet, that could delay cognitive decline and Alzheimer's, as well as the other headline that came up with Alzheimer's about the potential use of lithium that could reverse it. Dr. Hessler, I'm going to point this one back at you. New research shows that making positive lifestyle changes, such as regular physical activity, cognitive training, and improved diet, can help delay cognitive decline and reduce the risk of Alzheimer's disease, even in people who have a genetic predisposition. This was in a study led by researchers in Finland looking at individuals who carried the gene, which is a known risk factor for Alzheimer's, the ApoE4, who have about 4 times the cognitive benefit from combined lifestyle interventions compared to non-carriers. Moreover, there was another headline looking at the role of lithium that also made big headlines. So, Dr. Hessler, how do walking and other physical activities help protect against memory loss and cognitive decline?
So this is a great question. And in December of 2024, the American Heart Association came out that people should get 150 minutes a week of moderate exercise. So we want to be good to our hearts, and we want to be good to our brains. As a neurologist, I have a little preference for the brain, but the heart is important too.
Yes.
And but with walking, and increased activity, it's thought that this brain-derived neutrophilic factor, we call it for short BDNF, is a protein that supports the health of brain cells. So actually, in that article that you mentioned, Joe, I liked the analogy. I'm going to play off of Dr. Donna's, except for I really like that egg analogy, Dr. Ivory. But they describe BDNF as the fertilizer for your brain. So we want to keep those neurons healthy as long as we can. So again, that physical activity, I tell my patients, with that 150 minutes, that's a 30-minute moderate intensity walk 5 days a week. And so for a lot of people, that's doable. It's just finding time and prioritizing our health to do that. So that's why it's thought that walking and physical activity can help with memory loss and decline.
What role do brain healthy diets play in reducing this risk? And I know the question immediately, what foods are the most beneficial in those diets?
So this is always a hard question. I mean, I think I struggle with this, and we as physicians do as well, because I happen to really like chocolate. I don't know about you, Dr. Sirven, if you like chocolate, but really that Mediterranean diet, but actually for brain health. So Mediterranean has been popularized for some time for a heart healthy diet. But the diet that called the MIND diet is actually a combination of Mediterranean plus the blood pressure lowering DASH diet. So the things to consider is the green leafy vegetables, olive oil, whole grains, and lots of berries. So actually I found, especially 1 to 2 servings per week. So that's not that much of blueberries and strawberries. Are particularly important. And looking at these different dietary interventions, these are pretty good sized studies, 93,000 participants. Wow. And actually, they studied in adherence to the MIND diet over 10 years, had a 25% lower risk of dementia. So as I tell my patients, we can't change our age, we can't change our family history. So we can lie about our age. And I think I now have hit a part of my life where I'm going to start going down now. I don't know about you, Dr. Sirven, but I'm going to start going in the opposite direction. I don't think Dr. Nielsen's is my age quite yet. But so anyway, so I think, we can make some, small changes in our diet. I think that really can have beneficial effects because we can't change our genetics. So if you are one of those people that do have, and I'm a neurologist unfortunately, with my own family history of Alzheimer's disease and my maternal grandmother, I can't change that. So, again, we need to look at those things that we can do lifestyle wise and diet wise that really can help decrease that risk. And that's a pretty good size risk decrease.
Hey, it's Dr. Joe Sirven. I have a new show called This Week in Health, and it's part of WJCT News Now. Local news you can listen to anytime, anywhere. When you sign up, you'll unlock 4 local podcasts delivered straight to your podcast app. I break down the week's biggest health headlines and what they mean for you. Start a free 30-day trial at wjct.org/newsnow. And if you like it, become a monthly donor to support WJCT Public Media. All right. I appreciate that. We're going to pivot to yet another topic, and we're going to point this to young Dr. Nielsen here, Chad. And we're looking at a Legionnaires outbreak in Harlem, of all places. Legionnaires disease outbreak has left 2 dead, sickened 58 people since late July. The severe pneumonia caused by Legionella bacteria is linked to contaminated water vapor from cooling systems. The cluster spans 5 Harlem zip codes. Officials urge anyone who has cough, fever, shortness of breath, who's been in the area since July 2025, to seek immediate care, as early antibiotics are key. So, Chad, just remind people, what is Legionnaires and how do people get it in general?
Yeah, Joe. So Legionnaires is a disease caused by the Legionella bacteria. So Legionella bacteria is actually very common. It's ubiquitous around us, mostly in water. In certain parts of the United States, it's in the groundwater system. Legionella will typically contaminate water systems of buildings, hospitals, different types of facilities through the water system, either through pipes or through their heating and cooling systems. And it does that because it can actually disperse via aerosolized droplets. So it becomes very easy to spread. If you get a little bit of Legionella in a system and a little bit of heat, it can rapidly multiply and spread itself through water systems or heating cooling systems, thus making it very hazardous for human health.
Why do older adults or those who have chronic illnesses seem to be especially vulnerable to this?
So with Legionella, as is a lot of infectious diseases, individuals who are older or have knocked out immune systems due to cancer treatment or chemotherapy, they don't have the ability to really fight back when Legionella gets into their system. And because Legionella is so, lack of a better term, smart at infecting humans, especially their lungs, it can cause quite a bit of harm in people who don't have fully functioning immune systems or those who are weakened. And that would include kids who have underdeveloped immune systems. That can include pregnant individuals whose immune systems are perhaps slightly weakened. It's a very opportunistic infection. And unfortunately, it becomes harder and harder to fight. The older you get, the younger you are, or if you have something compromising your normal healthy immune system.
Chad, how do you prevent this? I mean, is this something that this has to be done by buildings or how do you what steps should people be taking or cities or government to prevent these outbreaks?
Yeah, so we do have a good playbook in terms of how to prevent Legionella or Legionnaires outbreaks, especially when it comes to buildings and other facilities. Really, cities should be maintaining their water systems appropriately. Buildings and different companies should be maintaining and using steps to control Legionella in their cooling towers, hotels for hot tubs, and all of these things are tried and true in a playbook of how to keep it out. Keeping the water temperatures outside the range that Legionella needs to thrive is also crucial. Implementing water treatment programs with what we call biocides or other disinfectants like chlorine in water systems, conducting risk assessments, increasing awareness. These are all really good steps that we know prevents it. Anytime we hear about in the public health community a Legionella outbreak in the facility, we know right where to go to and the steps that immediately we can take to end that outbreak. But these guidelines can be put into place preventatively. And so I think it just takes vigilance, good facilities, good water management planning. And I think that's going to be the best ticket to keeping this out of the systems.
All right, we're going to pivot to yet another topic. And Dr. Ivory, we're going to point this at you. And this has to do with something we've talked about before, but it continues to just get headlines as it should. The alarming rise of cancer in young women and how to protect oneself. We know that in recent decades, cancer has been shifting its target, striking younger adults, particularly women, at unprecedented rates. Since 1990, early onset cancer has surged nearly 80% worldwide, with women under 50 now facing an 82% higher rate than men their own age. This is from breast, colorectal cancer, to uterine, and rare sarcomas. These cancers are often aggressive, diagnosed late, and occurring in women with no obvious risk factors. So I guess, Dr. Ivor, I'll start with the question we've asked frequently, but I'll ask it again. Why are cancers in women under 50 rising so dramatically, and why are they so aggressive?
If I had the answer to that question, I wouldn't be working.
I hear you.
I tell you. So where is it pointing? Number one, colon cancer is probably the biggest one of all of those when you talk about more common cancers.
Right.
But you're also seeing a lot of rare cancers. So there are multiple reasons. Our ability to diagnose is better. Young people with cancers will typically have a more aggressive cancer. That goes with the territory. Even in high-risk people who have cancers at a young age, those cancers are more aggressive. So that component is there. When we talk about starting to see this in the 90s, and we talk about exposures and what is the impact of exposures and risk factors, if you go back 20 years in the 70s, what changed in society in the 70s? Plastics were introduced ubiquitously, especially in food preparation.
Right.
Breastfeeding was downregulated or really discouraged in favor of formula. And other environmental exposures became more common. And the way we prepare foods and the nutritional component of traditional foods has changed radically.
Got it.
Those are multiple factors that any one of those things can point to a problem. And now, as we see a further acceleration in early cancers, then we have to start looking at the exposure to what we call forever chemicals and the exposure from cosmetics and skincare and other things that young women have done so much more aggressively in the last 20 to 30 years. All of those factors come into play.
You've mentioned some huge points that if I flipped it around, I'd almost say they may be a way of looking at practical steps that women can take today to reduce their risk. What are just some simple practical steps that women can do now to reduce that risk?
One of the things we talk about when we talk about foods, we talk about exposures. I send my patients and my clients to the Environmental Working Group Dirty Dozen list every year, where they give you a list of the top 12, top 15 foods with regard to residual chemical exposures, pesticides and things like that. So avoid those and try to go organically whenever possible.
Got it.
I preach, get plastics out of your kitchen. These non-stick ceramics are plastics. Stainless steel, cast iron for cooking.
Got it. Okay.
When you're preparing foods, glass for storage. If you're putting something in the microwave, grab glass or old-fashioned ceramics so that you're not getting the potential for leaching of plastic chemicals in food. Stop drinking water out of plastic bottles, including reusable bottles that have plastics. Those are the places that I would start. I would also encourage everyone to remember, simple numbers. I mean, and that's something if you want your audience to have some look at numbers in terms of what young women are dying from, or what when they're dying from cancer versus not now, post COVID compared to say 2008. I have those numbers sitting here. It's not a huge number of women. And so don't be panicked. Don't get scared. Don't think that everybody's going to have cancer. But the leading cause of death for women in any age category until 80 is cancer.
Got it. Okay.
From 30 to 80 is cancer. So you need to be on top of your exposures and your family history to assess your risks. And then we go from there.
Understood. And up next, our experts answer your questions. And we'll be right back.
Did I get a letter? Did I get a postcard? Woo, Mr. Postman. Just another bill to pay. Just another bill.
Welcome back. I'm Dr. Joe Sirven, and this is What's Health Got to Do with It. You know that music. Our producer, David Luckin, joins us now with questions for our experts from our listeners. And it's an honor to have you here, David.
It's my pleasure.
All right, David, what do you have for us?
Chris from Flagstaff asks this question. As someone who lives in Arizona, basically at sea level, and loves to travel to neighboring states for outdoor recreation, it can be quite challenging to adapt to such a drastic altitude change. We're talking about 10,000 feet here when I go to Colorado. I've never experienced an episode of altitude sickness, but I would love to put in place healthy practices to keep this healthy streak going on my travels.
Dr. Hessler, can you help Chris out in terms of what's the best thing you should do to prevent getting sick from big altitude changes?
Sure. So really, to prevent altitude sickness, the most effective strategy is to ascend gradually, allowing your body to get used to the climate and the altitude changes. You want to stay well hydrated. You want to avoid alcohol and excessive physical exertion. And then if you do have a problem with altitude sickness, there are medications that can be prescribed, but those are some good strategies for Chris to think about.
Got it. All right, David, what else do we have?
Sebastian from Scottsdale. I've got friends who are tan and ready and rested and claim they hardly ever need sunscreen. But I've always heard that any sun exposure can damage your skin and raise your risk for skin cancer. Are they really putting themselves at higher risk? And should I be telling them to lather up when they're out in the sun for a while?
Dr. Ivory, what's your thoughts?
Absolutely 1000%, because we know that UV exposure can increase the likelihood of skin cancers. And the lighter the skin, the more the increased risk. So this goes with the early cancer diagnoses. Melanomas are on the rise, and sun exposure and excessive exposure can certainly impact melanomas. So yes, lather up 2 or 3 hours after you've been out, lather up again. If you've been swimming, lather up again, use sunscreen.
Great advice. David, what else do we have?
Well, back to the state of Florida. Barry from down south right here in Florida in Fort Lauderdale asks, I've been hearing more reports about dangerous flesh-eating bacterial infections lately. Is this really becoming more common? And if so, what's driving the rise? Is it climate change, water exposure, or something else entirely different?
Chad, we're going to point this at you. What's causing this rise?
So the short answer, Barry, is yes. Cases of Vibrio vulnificus, otherwise called the flesh-eating bacteria, have been rising actually for several years. And here in Florida, we are on track currently to break last year's case record. Indeed, experts are blaming some of this on climate change related issues, and that's because Vibrio does really well in warm water. And so as we Floridians know, watching hurricane season, warm water doesn't just mean stronger hurricanes, it means polluted water because bacteria can grow at higher levels. More frequent severe weather, speaking of hurricanes, also cause more flooding, which allow bacteria flooded waters to get into areas they shouldn't. That's why they always tell you don't wade around in flood water. If you don't have to be walking through it, you shouldn't, because things like Vibrio vulnificus and other water pathogens are in that water. So I think if you wanted to avoid it, what I would say is make sure that you are not handling raw seafood, especially clams and other types of bivalves, without gloves on. Limit raw seafood consumption, particularly pregnant women, those with immune systems that are weakened, and try and stay out of that brackish, sort of fresh, salty, mixed water as much as possible without protection.
All right, David, what else do we have?
Caden from Scottsdale, he's asking us, what advice would you give to a young professional to enter a career in healthcare? I would love to hear broad advice on the industry as well as specific advice to someone hoping to become a physician.
And Dr. Hesser will point this at you. It's a general philosophical one, but what advice would you give to someone hoping to become a doctor?
Good gosh, Joe, this is a great question, but I'm sure all of us on this call could give an entire 1 hour answer to this question. So, I love my career as a physician, and there's no other career that I would have chosen. My mom will tell you that all my dolls were sick when I was 3 years old, and so I always knew I wanted to go into healthcare, and I always wanted to be a physician. So, important things is keep your grades up, and I think that medicine has changed, and I'm sure Donna, you and Joe have seen definite changes in your careers, and I have in the last 20 years, as far as there's a lot of business aspects. So consider some business experience, not necessarily getting an MBA. I'm not suggesting that, but there is, being a physician is incredibly rewarding. We get to take care of people, and they trust us with their healthcare and their lives every day, and come to us for advice. And best of luck to Caden. And I guess I'm also saying this because I want there to be physicians to take care of me in 30 years when I have more healthcare needs. So I want there to be good physicians. So Caden, I'm cheering for you, and I'm glad that you're interested in becoming a physician.
Great advice. David, what else did our listeners ask?
Martin from LA. I know that you can't eat raw meat because of bacteria, etc. However, is raw meat alternative safe? I assume there's no bacteria associated with it because it's some plant-based alternative.
Chad, this is an interesting question to me. What is the safety of raw plant-based meat substitute?
So I don't think I've ever heard of somebody eating raw meat alternative, but I guess theoretically they are safer because you're talking about raw vegetables versus raw, chicken or beef or something. I will say they could still carry some risks of farm or factory contamination, like other vegetables that are served raw and ready to eat. But you should be washing those types of vegetables. I'm not really sure you can do that with that meat substitute burger. I have seen, though, some upscale restaurants are starting to serve meat substitutes raw. But I will say, sort of like sushi restaurants, they generally source it from places with very strict manufacturing and handling protocols, so it reduces that risk. But I would say I would still recommend cooking your meat substitutes just to be on the safe side of things.
Dave, I think we have time for one more question.
Well, it comes from Alex in Pasadena. There's been a lot of buzz, pun intended, about chikungunya in the news lately, especially in China, where officials are using drones, surprise home visits, and other tough measures to fight the outbreak. Are these kind of tactics effective? And do they cross a line when it comes to people's privacy?
All right, Chad, I think I can answer this question, but I'm going to point this one at you. What do you think?
Well, just to level set, chikungunya is a mosquito-borne virus carried by the same type of mosquito that carries dengue and Zika and all the other things we hear about in the news. I think, These cases have been rising in certain parts of the world, including Brazil and obviously in China. It's historic right now in China because they had certain areas of their country were prone to huge floods this season. And so the health officials are using measures like fogging and aerial spraying and door-to-door checks to eliminate stagnant water and sometimes to quarantine hospitalized individuals, which is probably not helpful. I think different countries have varying perspectives on what their privacy and their public health rights are. We've touched a little bit about that here on the show with some of my topics. But I think it's challenging for me to judge others' methods, especially if they are somewhat effective. But I will say that the most effective things they're doing right now is eliminating that stagnant water so the mosquitoes can't reproduce, and then the aerial spraying and identifying and treating cases as soon as possible. So anything beyond that maybe won't help as much, but certainly could cause some harm depending on the person and place.
I want to thank the three of you, Chad Nielsen, who's Director of Infection Prevention Control at Nemours in Orlando, Dr. Donna Ivory, an OBGYN, podcast host and author, and you, Dr. Amy Hessler, practicing neurologist here in the Jacksonville area, for all of your wisdom and insights. I learned a lot today. I think all of our listeners will as well. And that's our program for today. We hope you've enjoyed our show. If you missed anything, you can listen to the full episode at WJCT.org and on your favorite podcast app. Thanks to all of our guests. Our executive producer is David Luckin. Stacey Bennett is our producer. Brady Corum is our director. Caden Collins is our researcher. If you have questions about this or any topic, let us know by calling us at 904-358-6362. Email us at health@wjct.org or tag me on social media at jsirven. I'm Dr. Joe Sirven, and you're listening to What's Health Got to Do With It on WJCT News 89.9 Jacksonville. Thank you for listening, and stay in touch.
Support for What's Health Got to Do With It is provided in part by the American Brain Foundation. Invests in research across the spectrum of the brain, knowing all brain diseases, disorders, and injuries are connected. There can be no cures without research. Learn how you can make a difference today at AmericanBrainFoundation.org.
Rethreaded needs you to make a difference in the lives of human trafficking survivors. Learn more about supportive services and an array of survivor-made products at rethreaded.com.
And by Neurelis, a leading neuroscience company focused on the development and commercialization of therapeutics for the treatment of epilepsy and other neurologic disorders. The company's unique drug portfolios strive to address unmet needs in patient care. Learn more at Neurelis.com.